The following is for informational purposes only and is not intended to be used in the place of a medical provider. Your medical provider will be able to tell you what is best for your personal health decisions. Here we will review sexually transmitted infections, how they normally present, and how to best protect yourself. A sexually transmitted infection is any infection that is spread through any type of sexual contact, and they are not limited to only intercourse. There are a few ways to prevent sexually transmitted infections. The only sure way to prevent an STI is to refrain from sexual contact. A condom is a barrier that is put on an erect penis and physically blocks ejaculated semen. It can also prevent exterior infections from coming in contact with a partner's body. Condoms can help reduce the chances of becoming infected with organisms that can cause AIDS, genital herpes, cervical cancer, genital warts, syphilis, chlamydia, gonorrhea, and other diseases. Condoms can break. It is best to use condoms as an adjunct to more effective birth control methods, such as IUD or birth control. It is important to understand how to best use condoms properly in order to prevent accidents from happening, such as a broken condom. The Gardasil vaccine can protect you from certain strains of the human papillomavirus. Human papillomavirus is a common virus that is carried by men and women. If acquired, HPV can lead to cervical cancer in women and possibly genital warts in men. For this reason, the vaccine should be given to girls and boys before they become sexually active. Women should also get a pap smear beginning at the age of 21 to help detect the HPV virus. When to see your provider. Practitioners can evaluate and diagnose common sexually transmitted infections, and when it is appropriate, they can treat you. Practitioners can also help counsel you about your sexual health, your sexual practices, and how to protect yourself and your partner from sexually transmitted infections. You should see your provider if you have started to become sexually active. A yearly exam is recommended for sexually active adolescents and adults. Here, your provider can help screen for sexually transmitted infections. If you are concerned that a partner has cheated on you, or if you are starting to experience new symptoms in your genital region. If you are interested in preventing pregnancy, your provider can help educate you on the different ways to do this. So how do sexually transmitted infections look and feel? A person should seek medical care if you develop a new rash, bump, or lesion in your genital region. Also, if you start to develop pain or discomfort in your genitals or your lower abdomen and pelvis, this is a reason to seek medical care. Itching in your genital regions is also another reason to seek care. If you develop abnormal discharge, this can include a new odor or a change in color. If you start to develop burning during your urination, this can indicate a simple urinary tract infection, or it can be a sign that you have a sexually transmitted infection. Pain during intercourse is also an indication that you should see your healthcare provider.